All right, 8:15. Medicare's annual enrollment period kicks off Saturday, October 15th. If you want to change your Medicare coverage for 2024, this time do so. Calvin Mallett joins us on behalf of People's Health. Dr. B is going to be on with Newell Norman later on to discuss the annual enrollment period and Medicare plan options. Good morning, Calvin. How you doing?
Good morning, Tommy. Pleasure to be here. Thank you for having me, sir. We're doing well this morning.
It can be confusing. I'm going to tell you what, having gone through with my parents, what is the annual enrollment period?
The annual enrollment period, or AEP, is a set time each year when people can make changes to their Medicare coverage. It runs from October 15th to December the 7th, and any coverage changes made during that time go into effect January 1st.
And
what you need in the healthcare plan can
please.
change from year to year. So it's important to review your coverage yearly, and now it's the perfect time to compare your current plan with other plans and options on the market.
If you have Medicare, is this the only time you can make changes?
Generally, AEP is your chance to make changes or coverage, but there are some exceptions to this rule. You can meet certain criteria. You may qualify for a special enrollment period, which lets you make changes at other times in the year. You may qualify for one of these enrollment periods if you have a change in Medicaid coverage, lose your coverage through your employer, you move outside of your plan service area, or if you want to enroll in a 5-star plan. We'll talk more about star ratings later. Keep in mind, many people don't qualify for the special enrollment period, so be sure to review your coverage before the December 7th deadline. Even if you're happy with your current plan, it's important to make sure that there won't be any changes in 2024 that make it harder to get the care that you need.
How do you know, Calvin, what changes your Medicare plan is making for 2024?
If you're enrolled in a Medicare health plan, you should have already received your annual notice of changes from your plan. This is a list of coverages and changes that your plan is making effective for January 1st. You should also have access to your plan's evidence of coverage, which outlines your cost and benefits for the upcoming year. Use these documents to decide whether your current plan will continue to meet your needs in 2024.
We're talking to Calvin Mallett, People's Health, about Medicare's annual enrollment period. Calvin, do you have to change your Medicare coverage every year?
No, great question. No. It's always important to review your plan's cost and benefits for the coming year. But if you're satisfied with your current health plan, you don't have to make any changes during the AEP. You'll automatically stay a member of your current plan unless you enroll in a different plan.
All right, let's say you're not satisfied with your coverage. What changes can you make during that AEP?
You have several options depending on your current coverage. If you have original Medicare, you can switch to a new standalone Part D drug plan or enroll in one for the first time. You can also enroll in a Medicare Advantage plan. If you're already enrolled in a Medicare Advantage plan, you can switch to a new one that meets your needs better. Or if your current plan doesn't offer Part D drug coverage, you can also enroll in a new standalone Part D drug plan or have the option to return to original Medicare as well.
It is at this point that the eyes begin to glaze over. What's the difference between original Medicare and Medicare Advantage?
So original Medicare is administered by the federal government, while Medicare Advantage plans are offered by private insurance companies. These private companies have a contract with Medicare to provide coverage for Medicare beneficiaries. Original Medicare covers mostly medically necessary services in hospitals, doctors' offices, and other healthcare facilities. But it doesn't cover additional services like routine dental, routine vision, and it doesn't offer Part D prescription drug coverage either. That's why many people enroll in a Medicare Advantage plan. These plans must cover all the services that original Medicare covers, but most plans offer extra benefits too. Benefits like a fitness center membership, coverages for routine dental, vision, and hearing services, a credit allowance for the over-the-counter and health and wellness items, and many Medicare Advantage plans also include a Part D prescription drug coverage, so you don't have to enroll in a standalone prescription drug plan.
Do those extra benefits make Medicare Advantage plans more expensive than original Medicare?
Not necessarily. Every plan comes with different costs and benefits, but regardless of the plan you choose, your overall costs with Medicare Advantage plans are often lower than your costs with original Medicare. This is because Medicare Advantage plans are required to limit your yearly out-of-pocket costs, while original Medicare places no ceiling on your yearly expenses.
All right, 8:20, let's take a break, digest what we've heard so far. When we come back, we'll talk about choosing what coverage option is right for you or your parents. Calvin Mallett, our guest with People's Health, Medicare's annual enrollment period. The AEP kicks off Saturday. If you want to change your Medicare coverage for 2024, that's the time to do it. It's 8:20 now, time for traffic, WWL. 8:26, back with Calvin Mallett, Tommy Tucker, WWL People's Health. Medicare's annual open enrollment period kicks off Saturday, October 15th. So, Calvin, to pick it up, how do you go about choosing what coverage option is right for you?
Well, there are several things to consider when selecting your coverage, whether you're comparing original Medicare to a Medicare Advantage plan or comparing multiple Medicare Advantage plans. First, consider the cost, most important. Which plans offer services at a cost that best fit your budget? Don't forget to consider each plan's cost sharing, deductibles, and monthly premiums. Also, think about the kind of coverage that you need. Are your providers in network? Do you need Part D prescription drug coverage? Then finally, consider any extra benefits. Does this plan offer routine dental, vision, and hearing coverage? What about a free gym membership or emergency medical alert devices? Keep in mind these benefits bring additional value to the health plan, but only if you use them.
Let's talk about these star ratings that you mentioned earlier.
All right. Yeah, the star ratings are a great way to compare Medicare Advantage plans. In fact, Medicare developed its star rating system to give people with Medicare an objective measure of the plan's performance. A high star rating means that a plan keeps its members satisfied, provides quality customer service, and connects members to high-quality health care.
How can people find out more about People's Health plans?
Perfect question. You can meet with one of our representatives in person at the People's Health Medicare Center in Metairie. It's located at the intersection of Veterans Memorial and North Causeway Boulevard next to Party City. The address is 3017 Veterans Memorial Boulevard. Appointments are recommended, but walk-ins are welcome. We're also hosting in-person benefits presentations across Louisiana from now through December. Find a presentation near you at www.peopleshealth.com/meetings.
All right, WWL and People's Health are teaming up, too, for an event Tuesday, October 17th. We're going to be broadcasting live from People's Health Medicare Center, talking about all things Medicare, Medicare Advantage. We'll even have a special segment with Dr. B. You can listen live or stop by and celebrate with us in person. If people want to find out, again, more about People's Health, how do they do it?
They can go to www.peopleshealth.com/meetings. Or you can come to see us in person at the Medicare Center, 3017 Veterans Memorial Boulevard, at the corner of Veterans and Causeway, right next to Party City.
Thank you, Calvin. Some very valuable information. By the way, if you live or work in Houma, you can meet Newell Norman today at the new Primary Care Plus on Corporate Drive. He's celebrating a new clinic, bigger and better equipped to serve all patients. At 11 o'clock, they're going to have welcoming speeches and a ribbon cutting. Then you can tour the clinic starting at 11:30. They'll even serve up lunch for you. Don't miss the Newell Norman Show live from Houma at the new Primary Care Plus on Corporate Drive, 10 till 1 today on WWL. And, of course, first up, Dr. Brent Wallace, Chief Medical Officer of People's Health. We'll talk about making healthcare easy and affordable in the community and today's ribbon-cutting ceremonies. When we come back, we'll talk to Scott Boyle, Louisiana. He's the Assistant District Administrator of the Louisiana Department of Transportation and Development. Louisiana is getting $1.2 billion in transportation funding from the federal government. What's it going to be used for? Stay tuned. Tommy Tucker, glad you're with us. Time now for WWL First News.